Our next speaker is our very good colleague from the Pakistan Institute of Nuclear Science and Technology, Islamabad. He is working as principal scientist over there, Dr. Nadeem Ahmed Lodhi, and his expertise are on the targeted therapy agents that are upcoming now, and his talk will be on fibroblast activation protein inhibitors and emerging pan-cancer targets.
Bismillah ar-Rahman ar-Rahim. Today I'm going to discuss about fibroblast active protein inhibitors and emerging pan-cancer target. As we know that we have a lot of success recently in the theranostic because of the lutetium dotatate and lutetium PSNM, which is approved by FDA and successfully into the clinics for the treatment of neuroendocrine tumor as well as a castration-resistant prostate cancer. So what would be the next promising target? And probably it would be a fibroblast active proteins. And as we all know that tumor microenvironment consists of the immune cell, vasculatures, extracellular matrix, and especially the cancer-associated fibroblast. And the cancer-associated fibroblasts expressed with the markers, which is a fibroblast active proteins, and it is a type of type 2 integral membrane of glycoprotein of the serine protein families, and it expressed in 19% of expression on these type of cancers, especially the solid tumors, carcinoma, prostate cancer, breast cancers, hand and neck, and colorectal cancer. So this is the one of the best image which was declared as the image of the year in SNM MMI in 2019, which was developed by the University of Hospital of Heidelberg in Germany, which showed that it can efficacy for the Patriot tracer with a variety of cancers, and this is a novel tracer which able to detect 28 type of different cancers in the patients. So what are the fibroblast active protein inhibitors? Basically, if you see here, this one is basically the lead compound which was published in 2012 or 14. This show very high affinity and selectivity towards the FAP. And then the researcher has improved this molecule by introduction of various functionalities into the molecule, especially with this nitrogen atom. They increase the affinity and selectivity towards the FAP compared to some other protease families of these which are in the tumor microenvironment. And then they introduce this difluorine type of groups here to further increase the affinity with the FAPi. So if you see that here IC50 values, it show with the FAP with the number of 3.2 nanomole, that show that it show very high affinity and selectivity towards the FAP compared to some other protease families which are in the tumor microenvironment. So these are all the difluoroproline type of molecule which show very high affinity with the. So there are, okay, we'll skip this one. I'll skip this one. So there are a variety of FAPi derivative which were established by different groups and being used in the clinics and preclinical studies. So these are mostly FAPi4, which is very famous, like here, and this is FAPi46. The basic unit remain the same. However, the people are using different linkers and here to increase the affinity or pharmacokinetics, and especially this is a DOTA squaric acid FAPi molecule, which is developed by Professor Frank Roche. So they are all into the clinical or preclinical study for the evaluation of different in the different type of cancers. So the main issue with these FAPi derivatives are the kinetics of these are very fast. They take into the tumor, they uptake into the tumor very fast. but it also cleared from the tissue within few hours. So this is the limitation associated with the fibroblast active protein inhibitor. If you see here, this one, after 3 hours, it almost disappeared from the target. So here as well, after, if you see, the SUV max has decreased to the half within 3 hours. So that's the main limitations with the fibroblast active protein, because they show very high uptake, but it clear from the tissue very quickly. So that's not good for if you're applying theranostic therapy to the patient by using a FAPi derivative. It is not beneficial because it has a very low residence time into the tumor, and it clear from the tissue within a few hours. So what are the challenging? The challenging is main to prolong the residence time into the tumors, and how we can achieve that goal. We can achieve it by different strategy. We can use peptide instead of inhibitors, or we can modify the linkers into the molecule which show very good kinetics as well as uptake into the tumor. Or we can use some albumin binding structure into the molecule. So what the role albumin binder will play, it will bind to the albumin, and it keeps circulating into the blood, and with the time it will show enhanced uptake into the tumor. Another strategy, we can develop some FAPi dimers instead of one molecules. We can have a dimer, two molecules in a single molecular units. So these are the strategy which can be adopted to enhance the tumor uptake and residence time into the tumors. So what the people are now doing is they are doing it by developing some dimers. This is one of the dimer. This is a one unit, and this is another one FAPi derivative, and chelator is attached with this molecule here. This is Dotaga squaric acid FAPi molecule. If you see here, it show very good IC50 value. It means it show very high affinity and selectivity to the tumor sites. So this is one of the example of this dimer. So this is one of the patient injected with the 20 MCI of radius tracer. This is the Dotaga squaric acid FAPi molecule dimer developed by Professor Dr. Frank Roche in the University of Mainz in Germany. So it show very good residence into the tumor until after 168 hours into the tumors. So this is one of the Dotaga squaric acid, as I described in the previous slides. So there is some other derivative here as well. Instead of this squaric acid, they just use a linear chain of this alkyl group to attach these two molecule attached with the Dotaga as well. This is a Dota squaric acid, the FAPi derivative. So why they developed this one? Because if you see here, this Dotaga squaric acid FAPi derivative, it show uptake into some non-targeting uptake into because it show very high lipophilicity. So that's why it show very intestinal uptake through the RES system. But these, the previous one, the molecule, the next generation molecule, they developed to decrease this lipophilicity into the molecules, so it clear from the non-targeted tissue very quickly, show very good distributions and profile into the human. So they did some of the clinical evaluation of this Dotaga's FAPi derivative into the breast cancer. If you see, they given this is FDG uptake, and this is the gallium Dota squaric acid FAPi molecule. It show good uptake into the lesions, into the mats of the patients, and they given with the lutetium dotatate of the 5 cycles of these drugs. It show very good response, and if you see that the whole body image scintigraphy that the most of the lesion side, the tumor metastasis has been disappeared. So it's a very effective target for the treatment of the cancer with the dimeritic, if we adopted a dimeric approach as well. This is another example of this. The patient is given 4 doses of lutetium DOTAGA FAPi derivative, and show disappearance of some of the lesion on the sides. So it means that the best approach to enhance the residence time into the tumor is to prepare some dimeric instead of monomeric compounds. So the different group has developed these dimers. This is one of the example of Gothenburg University of Mainz by the Professor Frank Roche. They have developed these type of dimers. There are some Chinese groups who have developed this bio-onco-FAPi and these type of molecules as a dimer. And most of these molecules are into the preclinical or clinical stage for the evaluation of this FAPi derivative as well. So all of these dimers are working, which show very longer retention and good clinical outcomes. So conclusion is that it can be the one drug, single drug can effectively treat a variety of cancers by using this approach, by using the FAPi fibroblast active protein inhibitors. So our objective was as I told, most of these molecules are developed by some of the groups, which also they make it patent. Obviously, you can obviously use for the research purpose with our permission. However, if you want your own drugs to be into the clinics, so you need to have develop some of the derivatives. So we thought that we can develop some dimer molecules and we can do some clinical or preclinical evaluation of these dimers. So we adopted these molecules. We did some docking study of this molecule as well to check it whether it show high affinity with this FAP or not. So we selected these molecules and we synthesize it in our lab, and we radio label it with gallium-68 and lutetium-177, and we did some stability study, and further study is in progress, cell uptake study and biodistribution study in preclinical models like U87MG, which show very high expression of this FAP onto these tumors. So this is some of the synthesis scheme. I will not go into the detail because it's very complicated kind of chemistry involved, and most of here is a nuclear medicine physician. I will skip. So these are only the steps we used for the synthesis of these molecules. These are we prepared 2 derivatives, one with simple DOTA FAPi dimer, and the other one is DOTAGA FAPi derivative. These 2 molecules we have developed, and we characterize them, and we purified by using HPLC, radio HPLC, and we confirmed by using LCMS and NMR spectroscopy. And then we did the gallium labeling, and it showed very high radio labeling yield, 99.9% with the gallium, with a small amount of this precursor, even in the nanomolar range, like 40 nanomolar range. So it showed very, very good radio labeling. We confirm it by the radio TLC as well as the radio HPLC. And then we did lutetium study that whether these these molecules FAPi1 or FAPi2 show labeling with the lutetium. And you can see here these radio TLC scanners. It show this is for lutetium. This is labeled one, FAPi1, FAPi2. It show very good radio labeling, more than 99% by using radio TLC, and more than 95% by using radio HPLC. So we have done until this one work regarding the FAPi. So next future plan our is to check whether it show high uptake into the cell lines which are expressed with the FAPi. Another one, non-clinical evaluation by using the tumor-bearing mice, which is U87MG, which show very high expression of this FAP, or PANK1, which also have expression of FAP. So by using biodistribution either or by SPECT-CT imaging, and then obviously if we have a good result, we can get into the clinical evaluation of these radiopharmaceuticals. And at the end, I would like to thanks to the Dr. Ali Raza Anwar, Chairman PC, Member Science, Dr. Masood Iqbal, Dr. Shazia Fatma, DGNMO, Dr. Wasim, and my team, Mr. Kaisar Khan, Head IPD, and Dr. Irfanullah, Dr. Nasir, and Mr. Irfan. I would like to thank to them for their continuous support. And also I would like to thank Dr. Inam and Dr. Shazia for giving the opportunity to talk here. And last but not the least, I would like to thanks to my colleague in South Korea, in Seoul National University, Professor Kang, Professor Lee, and I recently visited there. I worked some part of this work in SNUH. So I would like to thanks to them for their support and their finance. And also this work is also the part of my IAS CRP. So I would like to thanks to the finance of this project to the IEA. And this man, the Professor Frank Roche, he inspired, he's a really world-renowned radiochemist, radiopharmacist. So inspired, I got a lot of ideas from him as well. So I would like to acknowledge him as well. So at the end, I would like to say thank you, Kamsamnida, and thank you for your attention. Thank you very much.